Today I'm going to talk about being on a waiting list and starting to recover whilst being on a waiting list for help. A lot of people find this very, very, very difficult because they feel like they need to get worse or continue being as bad as they are and not actually bringing themselves up whilst they're waiting for treatment, whatever kind of treatment that is. That's not a good idea. Once you are on a waiting list, you should be making progression through recovery yourself. Your idea about recovering, it has to be that you are recovering for yourself and your utmost priority is now to recover. It is in your best interests to recover, so it is in your best interest to start recovering whilst you're waiting for the treatment. And that's what you need to do. You need to start working towards getting better. Now obviously there's that fear that, I won't be sick enough for recovery anymore, they won't think I'm bad enough to give me support. That shouldn't happen. Good treatment teams will not reject you just because you have been able to pull yourself up a little bit and, make progressions and, make progress. That is just not what they will do. And if they do, because I'm sure there are very, very few instances in which this does happen, then they suck. People should not be rejected for being able to help themselves to a certain degree. And that should not happen, and it almost certainly won't happen. These people will provide you with the support that you need at the time. So when you were referred, you may need a certain level of support, but you may be able to pull yourself up a little bit further, so you require a slightly different level of support. And that's a good thing. It is not a bad thing. Your aim is to recover. Your aim is not for other people to see you as a certain level of sickness. If you want to recover, that has to be the main goal, the main focus, and it's a good thing that you level up and require less support, because that's what you're working towards. You are working towards needing no support. That is what you want to aim for. That's what you want your end result to be. So if you do require a slightly lower level of support when you get to your treatment team or therapist or whatever, then that's good. That's exactly what you want, because that is where you're aiming. You are aiming to recover. And I can't really stress that enough, because in the disordered mind, you want to appear the sickest that you can. You want people to think you are sick enough. Everybody thinks you're sick enough, honestly. There is no kind of not sick enough. When you're sick, you're sick. Whichever varying degrees of the illness you have, whichever diagnosis you have, you are sick enough. You are sick enough that you deserve and need recovery. Different people require different supports, different treatments, and they require different levels of treatments. And whatever level you are being given, you still need and deserve recovery. You are still sick. You just require something different to help you get less sick. And somebody else requires something different for them to get less sick. We're all individuals, we're all different kinds of people. We all require different things to help us. And, they will give you what they think is appropriate for your needs. Whatever that is, that's great. Use it. Use it. Any opportunity that you have, any support that you have, use everything and anything. But do not wait for it. Do not wait until you are actually having that treatment, because sometimes the waiting list can be horrendous. I waited 8 months, I think it was, for treatment, and that was just CBT sessions, not like an inpatient facility or anything. That was therapy, and I had to wait 8 months just to get some therapy, which is pretty appalling, to be honest. And if I had gotten worse within that time and decided that I didn't want really to get better, or I didn't want to get better so that these people wouldn't see me as better, or see me as not requiring it anymore, if I had spent 8 months doing that, it would have been horrendous. And by the time I'd gotten to that point and that I was going to get the therapy, I would have required something different, which then would have meant going on another waiting list for something else. And if you allow yourself to continue getting worse, the support that you end up having won't be adequate to your needs, and then you will have to wait again, and it will just spiral downwards, and it will get out of control, and it will be horrendous, and it won't be good, and it will not be positive. What you need to do is just continue looking and moving forwards, or onwards and upwards, as much as you can. Now, obviously this is very difficult when you're by yourself and you haven't got the support and you're on a waiting list for support or treatment. Doing it by yourself is really, really hard. And I'm not saying you're going to make massive, massive progressions, but anything, just always moving forwards, not moving backwards and not staying in the same place. Aiming to go forwards all of the time. Don't let yourself stop yourself, or don't let your eating disorder stop you from moving forwards, because you went and sought out treatment because you needed it. So at least part of you knows that you need to recover, and part of you wants to recover. And even those who might have been forced into recovery or firmly guided into recovery by somebody else, part of you will want recovery, I'm pretty sure. Most people do, and it's their eating disorders preventing them. But just don't let them. Please try and not let them keep you in one place. Please try and move forwards, because that's what you need. That is your goal. Your goal is recovery, so move further towards it. Quite a simple, straightforward video, but it was requested, so I just wanted to say, it is so difficult. It is so difficult. But yeah, I really, really, I've got to push that as much as possible, that you need to push yourself forwards, because recovery is the goal. Having this as the goal and having this as where you are and staying there, it's not getting you closer to that goal. And you want to be there as fast as possible. Honestly, you do. It may feel like you don't, but you do, because you're going to be a lot happier and a lot healthier up at the goal rather than where you are being miserable and sick and just, what a horrible thing an eating disorder is. So, you do want to be working closer to that goal, with or without treatment. And don't wait. Please don't wait. Treatment will also be a lot easier for you when you get there, if you have progressed a bit. That is all I have to say today. I've had an exhausting week of training, so now I am knackered, and I'm going to watch Supernatural and read and just flop and have the weekend off, which is going to be awesome because I'm going to sleep loads. So yeah, hope everyone's good, hope everyone is battling hard and making progress, and doing the best that you can. Speak to you next week.